Well, thanks for having me. I'm Maureen Busalacchi, Director of the Wisconsin Alcohol Policy Project. We are located at the Medical College of Wisconsin in the Comprehensive Injury Center. Our team is me and Felice. So our main purpose is to provide folks with technical assistance, tools, and trainings related to reducing excessive alcohol use. So I'm the director, and Felice is both a lawyer as well as a PhD in neuroscience. So she comes with a great background and ability to research not only medical issues, but law issues as well. So we have a public health problem related to excessive alcohol use in Wisconsin. In 2020, we saw alcohol deaths in Wisconsin soar by 25%. This is not unlike the nation, however, but because we have had a higher rate, this is even more of a detriment to Wisconsin. And this data includes not only the things you would expect, like liver cirrhosis, but also cancer, attributable deaths, acute deaths like poisoning, and then, of course, some of those deaths, unfortunately, like motor vehicle crashes, suicides, and falls. We're getting close to wiping out essentially the city of Algoma every year in Wisconsin due to alcohol use. So Wisconsin exceeds the nation. As you can see in the map, Wisconsin is all in dark blue. That means that we have the highest excessive drinking rate in the nation in every single county. The only little bright spot there is Lake Winnebago. And generally speaking, the national average of excessive alcohol use is 17.6%. Wisconsin, depending on the year, has between 24 and 25% on average. So what do I mean when I say excessive alcohol use? I'm talking about binge drinking 4 to 5 drinks within a 2-hour period, heavy drinking, which is basically drinking every day, any drinking during pregnancy, and of course, underage drinking. In 2018, we see some of the harm that binge drinking caused. So these are folks that most likely do not have an alcohol use disorder, but they're drinking excessively in a period of time. So why does this matter? Well, in particular, we think about our kids. We have an environment where excessive alcohol use is condoned. And so teenagers see that. And we know that it's really important to make sure there's education out there. But as I've said before, you can't throw minnows in a dirty pond and expect different results. So we need to think about our alcohol environment as a whole, but also how it impacts teenagers. And so clearly there's a number of issues here. This is scratching the surface in terms of risky behavior, harm to their brain, and a lot of mental health issues. In fact, with mental health problems, the more that there's drinking and mental health issues, the harder it is to treat. And it just compounds the problem even more. The other issue is, I know we work a lot as a community and as a state on drug use, and in particular opioid use. And I am as concerned about that as everyone else is. But one of the things we have to really think about is that teenagers who binge drink, so it's a lot of quantity, they increase their use or their potential use of drugs as well. So it's really important that we make sure that teenagers are not binge drinking, much less having alcohol at all. So the effects of the pandemic are still with us, but I wanted to share a couple of things that we learned from 2020. First of all, as I mentioned, alcohol deaths increased during the pandemic. So this has been well publicized, but the problem is you see this in 2020 and you don't really see it going down much in 2021. And that's the local data as well. So that's a big concern. We also had a lot of increase in revenues during the pandemic. So you can see here that alcohol beverage excise taxes increased considerably from about $63 million in 2020 to $74 million in 2021. We also thought you should have an idea of what's being sold. So you can see beer is really the biggest product that's being sold, and then you've got wine, liquor, and then I don't think you can even see the green line of cider, but it is in there. There were also bills by the legislature, so they did pass cocktails to go, and it's not a tamper-proof seal, but a tamper evidence seal, and so that is kind of problematic. It's not like in Wisconsin, there's a lot of problems with access to alcohol. And, so this bill was passed. What did not pass are kind of a statewide mandate to do click and collect, meaning being able to order online at your grocery store and then being able to pick it up. And communities had the choice as to whether or not they allow that. As well as alcohol home delivery did not pass in Wisconsin, except there's been a long-standing ability to deliver wine, but other beer and spirits is not allowed. So what's going on in Portage County? So this is data from 2018. It was actually 2018 data pulled in for a 2019 report. And you can see in this particular year, Portage is way up from the statewide average. And again, this is looking at binge drinking, the number of episodes per month. So you're almost at 4 binge drinking episodes per month in adults in Portage County. There's a cost to that. The estimated cost is almost $60 million in Portage County, and that's considerable. When you think about income to offset that amount, it's really much smaller. I'll talk about that in a little bit, but here's the cost. So if you break this down, there's alcohol-related deaths, hospitalizations, crashes, and folks in treatment. But you look at the biggest number there, lost productivity, it harms our employers. So they've got workers who are unable to work or are not working well because of their drinking. So that's, kind of a big issue to think about with economic development. You really want a workforce that's there and able to work productively every day. The criminal justice system is a big cost as well. So resources in your police departments are going towards dealing with excessive alcohol use, as well as in the court system. And then of course, there's the treatment programs that are funded by the county and or the state. So deaths are rising as well in Portage County. You can see that there's a little bit of bumping up and down, but in 2020 and 21, it definitely goes much higher. And in fact, that data is only through August of 2021. So when we get the full data, if the trend continues, you'd see 41 people in Portage County who died as a result. So one of the things to look at is also how much of a resource is being used to deal with impaired or those who use alcohol. So mostly they check first for alcohol use, And that's the most common use when there's an impaired flag. So this data comes from the Department of Transportation. And again, this is over several years from 2017. And the totals are there were almost 500 crashes reported in that amount of time, 16 fatalities, and 239 injuries. So there's a total of 492 of those crashes that are mapped. So you can see sort of where this is happening in the county, and it's kind of that clustering. But so then there's police resources, not only from the city of Stevens Point, but certainly from the county and other towns and cities in your jurisdiction. So there's an issue with cost. So this is 2015 data, so I'm sure it's more now. But if you look at the fatality figures, you've had 16 fatalities. And if those numbers are true, each fatality costs $1.5 million. There's a lot of police time and cost. There's an investigation. You've got time in the courts. So it's really a very expensive piece. And if we could prevent that, we'd be able to save a lot of money and resources that could be either used other places, or perhaps being able to keep costs down. You can see the other injuries and cost from that. So I want you to think about this for a minute. Collected around this period of time from the alcohol excise tax was about $63 million. And if that were proportioned out to all of the counties, that would mean Portage County, based on population, would have received about $723 million per year, right? If you look at just the cost of one fatality, it doesn't even come close. In fact, the cost of excessive alcohol use for Portage County is 60 times what is collected. So we definitely have an issue in terms of how do we pay for this stuff? So some of the ways that we could help bring those costs down would be to take measures to reduce excessive alcohol use. Unfortunately, we have some recommendations in that area. So this report came out. It's the State Council on Alcohol and Other Drug Use from the ad hoc work group underneath the Prevention Committee of SCAOTA. And there are a number of recommendations, and basically for many different agencies, community organizations, healthcare, and others. So one of those top tier recommendations is place of last drink. So that would be collecting information at the time of a crash, figuring out where is over service happening. So we find that in terms of licensed establishments, places that sell or serve alcohol, in Minnesota, they've done this for 8 years. 80% of licensed establishments are never named in a place of last drink. So you're talking a small number of licensed establishments that apparently overserve to the impact of someone having a crash or fatality. They also track domestic violence, other kinds of altercations, disorderly conduct, looking at where they were. So some of them are licensed establishments, some of them are at parks, some of them are at festivals, some of them are coming from home or a home that hosted a party. So it gives the community a better idea of where is this happening in our community? And then you can start thinking about what you can do about that. When we work with law enforcement, if there's a licensed establishment that is consistently overserving, we can certainly have law enforcement go in and work with them and try to bring that over service down and make sure that people are well educated as servers, not to overserve. It's also coupled with alcohol age compliance checks, becomes a very good comprehensive tool to both enact and implement all of the recommendations around place of last drink and make sure that our kids are not getting alcohol. It's an important message to send to our community that we don't welcome retailers that are selling to our kids, right? That we're a community that wants to make sure that that's not happening. So it's important that the public knows what's happening with those alcohol age compliance checks, that they're happening twice a year. And of course, both with place of last drink and alcohol compliance checks, everyone knows about it. Licensed establishments are certainly informed, but also in the media. So the public is also informed. Doing those things together can help reduce allowing kids to drink, but also reducing that over service that is happening that ends up causing a lot of harm in our community. You can also look at your alcohol license process. So there's a number of tools in that toolbox to make sure that you're being really wise about licenses, and making sure that there's criteria for your licenses, and also dealing with provisional licenses, license conditions, and non-renewals, if that's necessary. Provisional licenses are like your festivals and your fairs and that kind of thing. And it can be really important to put checks in place because that's often the most common area where kids get alcohol. And certainly not having alcohol just anywhere is a concern unless it's very carefully monitored. This is just a quick glimpse at the alcohol licensing process. What's required by state law is in the purple line, but you can see that there's a number of things that many communities across Wisconsin do in order to make sure that they're really giving this new application a proper look and making sure that it fits within the community and the community vision as well. Some other things that can be done, certainly looking at click and collect. So this means, being able to order alcohol online, through a grocery store or another licensed establishment that's allowed to do that. The concern is that there's somebody who is actually being able to be monitored, giving the alcohol to the person and ensuring that they are not already intoxicated, which is illegal to serve someone who's already intoxicated, and that they're not underage. There's also sober server ordinances. So I think it's one of those questions about if the person serving is intoxicated, how well are they going to be able to track and make sure that they're not over serving their customers? So I think that's really an important piece to make sure that that is in place to reduce over serving. You can also look at the outlet density. That would certainly be a good thing to do, and maybe overlay that with where you're having a lot of those OWIs. So outlet density is really an important issue. We know that when there's heavy density in a community, we can also see the impact of ACEs, so adverse childhood experiences. There tends to be more child neglect when there is an oversaturation of alcohol licenses in a community or within a neighborhood. So those kinds of things are really important to help build healthy, thriving communities, to take a look at that in your own. So the recommendations, again, alcohol age compliance checks, looking at that place of last drink, not only collecting that data, but making sure there's interventions. The idea is to help bring communities along and bring along licensees so that they are in compliance and not over serving. Looking at your liquor license review process, using alcohol license conditions. So for festivals, making sure you've got a fenced off area, that someone is checking the IDs and understands how to do that. and using wristbands so we know who can have alcohol and who is not allowed, and not having underage people within the area where they're serving alcohol. Looking at sober server, those click and collect policies, and looking to reduce alcohol outlet density, mainly by just looking at new licenses and considering, do we need another place for alcohol to be served in our community? I think one of the questions is to think about the marketplace. Is there a lack of alcohol that can be sold, um, and purchased in your community? And so maybe it's time to kind of start thinking about bringing that back in line. My guess is there's plenty of access. So happy to answer questions. Like I said, our organization, the Wisconsin Alcohol Policy Project, is here to provide technical assistance, training, and then we have a number of tools on our website that could be helpful to you as well. Thank you for the opportunity today.